Hi, everybody, and welcome to 5 Minutes With. My name is John Younger with Assisted Living Locators, and I'm absolutely thrilled to have Stacey Blakeslee with All Care with us today. So take it away, Stacey. Nice to see you. Let's have a great 5 minutes.
Thank you,
Tell us
John, for
what you
having
do,
me. I
Stacey. Of
appreciate
course.
it.
My
So my
pleasure.
name is Stacey Blakeslee, and I'm the Business Development Representative for All Care VNA and Hospice. So there's actually 9 of us. And we do everything from going in assisted livings or nursing homes and get referrals. So whether that be for the visiting nurse, somebody's coming from the doctor's office, or they're coming from a skilled nursing facility and going home, we can put in the nurse, the PT, the physical therapy, the occupational therapy, speech therapy if needed, home health aides. We also do hospice care, which is great. So we can do that wherever the patient is. So if they're at the hospital, if they're home, if they're in assisted living, we can go right in and do those services. And we also do palliative. And the nice part of our palliative program is that we actually have a nurse practitioner who visits and follows up on all of our palliative patients. And it's a way of giving back to the community. So that's been a really strong, positive program. And we see a lot of people who will be palliative, they're not ready for hospice yet, and go right to hospice, and the nurse can just flip them easily. So it makes it really consistent for the patient. We also do private pay services, and I know you've had people on who do private pay services, so everything from homemaking to home health aides, people to go to appointments with you. The one thing that makes us a little bit different is we actually partner with the area agencies on aging, such as like Mystic Valley or something like that. So sometimes you can have the same aid that you have through if you're privately paying for an aid, and have the same aid through Mystic Valley. So that's been really, really nice. And that is very consistent for the people. And we've been up and running for a long time with that. We also have a adult day health center in Chelmsford. So that's fun. That's where people go during the day when families are working, things like that. It's a great way to give the family a break, but also to get the person socializing and have people there that are checking in and getting meals and being stimulated. So that's been really, really helpful. And then we also offer an adult foster care program, and that's for people who live together. So say a mom lives with her daughter, and her daughter is caring for her 24/7. That's something that the daughter, they can get some help in the house, some services in the house, so that it allows her that if she needs to go run an errand or do something like that, she can do that. So that's a really, it's a very growing area that we're seeing. So probably in the last year, it's grown over 40 patients. So it's really just a huge service that we're seeing, and just a huge need.
Wow, that's terrific. So All Care really is all care,
It is.
right?
It's
Yeah,
all
it's
under
a
one roof.
Yeah, so you meant VNA, palliative care, hospice care, in-home care, the adult day, the adult foster. That's new to me. I don't recall that. That's great. That's good news.
Yeah.
That's a really excellent service.
And that's, for me, it's so fun when I get to go out and see people and talk with social workers or talk with nurses. We're looking at the whole person to see what works for them. Okay, maybe the visiting nurse works now, but maybe they do need the adult day health, or maybe they are eligible for adult foster care. So we can make that referral, and it's all under one roof, and we're all working together so we can make sure that this is covered for everyone.
That's terrific. So just a real quick question, and we only have a few minutes, but can you talk a little bit about the difference between the hospice and palliative? I know people
Yeah.
get kind of confused with that.
Yes. So hospice is when someone has a terminal diagnosis of 6 months or less. That does not mean that person is imminently dying. It just means that the diagnosis is there. And really what it is we're providing support services for their caregiver. So that could be, of course, nursing. That might be sending in a home health aide. The person could be in a nursing facility, and we're sending in the home health aide 5 days a week to help with the nursing facility, to position somebody or to get them cleaned up. It gives them a break as well. The palliative is when somebody may not quite be ready for hospice yet. So they're thinking about it, or they're still pursuing some treatments that they want to continue to pursue. They have another wound specialist appointment coming up that they really want to see what that person says. And so they're kind of getting there, but they're not there yet. And the nice part is with our nurse practitioners, we're seeing these patients, we're talking to these patients. So they're actually being followed by a medical professional that they can call this medical professional and say, this is what I'm struggling with. I don't think I want to do this anymore, or I do want to do this. So we can really help guide them and see them as they change, especially if they're home and they had a fall and they ended up in the nursing facility. We can then follow them in the nursing facility as they're doing their rehab to see how they're coming along, make recommendations, attend meetings, things like that.
That's terrific, Stacey. Thank you so much. So tell us where All Care covers and how would someone get a hold of you?
So the amazing part is All Care covers 60 towns and cities in Massachusetts. I'm going to get my information here. So we go all over from the North Shore to all the way down to about Waltham. We cover Bedford, we cover Reading, you name it, we cover it. We've been around since 1911. And if somebody had any questions or wanted to make a referral or just needed information about All Care, the main phone number is 781-598-7066.
Awesome. Thank you. 1911. That's actually older than me. That's cool.
1911 originated in Lynn.
Wow. Awesome. So very local then. Stacey Blakeslee with All Care, thank you so much for being on 5 Minutes With. Very enjoyable, and have a great day.
Thank you.
Take care.